Welcome back to my channel YouTube. My name is Nanda and today I am wearing red because February is American Heart Month, and in this month the United States raises awareness on heart disease prevention. And so I feel that this is an extremely important topic because 1 in every 4 Americans dies from heart disease on a yearly basis. And so I believe that there is so much that we could do to prevent and to stay healthy. And so this video is not going to be medical advice or anything like that. It's really going to be more of some tips and suggestions on how to prevent heart disease. And it's really coming from someone that is just the average person trying to take care of their health. And if there's anything that you can take away from this to help you in your own journey to be healthier, then my intent is to make sure that I can provide you with some of that information in the event that you're also looking to be healthier for a long time. So if you're wanting to learn more about how to prevent heart disease and stroke prevention, then you're going to want to stick around. So I guess a very good place to start is for us to talk about who are the people that are most at risk for heart disease. And there's really like 5 different types of people that probably have more of a tendency to get heart disease. And first off is people that have high blood pressure tend to end up having problems with heart disease. And high blood pressure a lot of the times is hereditary, so if you have a family member that has had a close family member, like your father or grandfather or whatever, you could have that family history that would push you into a more of a risk category. So think about that. Number 1, ask yourself if there's anybody in your family that actually has high blood pressure or if they've ever had strokes. I will share with you that in my family, for example, my one side of my family does have a tendency to have high blood pressure. My grandmother ended up having strokes, and she ended up she died because of that. And my father has also had strokes, and I'll tell you that in my particular experience, I've been told that my blood pressure is definitely pushing up, and I will say that you can prevent and you can lower your blood pressure through normal lifestyle changes. However, if you are someone that has a family history with high blood pressure, you might end up just having high blood pressure for the rest of your life if you can't bring it down with just normal lifestyle changes. So one thing that's important is to make sure that you're always kind of managing that. And I can't stress enough how important it is to track your blood pressure if you're someone that might have a tendency to have it, because blood pressure, number 1, is something that you really don't feel, and it could be what they call the silent killer, and it just comes out of nowhere. And so preventing, and I'm going to talk a little bit about that later in the video, but preventing high blood pressure is definitely something that it's important if you're wanting to prevent some heart disease. Another group of people that actually have a tendency to have heart disease are people with high cholesterol readings. And you want to make sure that when you're visiting with your doctors that you're tracking the good and the bad cholesterol levels. So when you're visiting with your doctor, just make sure that when you have your annual annual reading exams and you have your lab work, that you become familiar with those numbers, and that when you actually walk into the doctor, that you have the information in front of you, so you can start that conversation with them about how you're doing. Keeping your cholesterol levels at the right ranges is important for you. The other group of people that tend to have more of a tendency or risk for heart disease are diabetics, people that are either type 1 or type 2 diabetics, and just you need to really monitor your blood sugar levels. And so I don't have a lot of experience in that, but I do know that diabetics could have an issue with heart disease in the future. Also, you have another group of people. And again, I mean, you can have a little bit of everything, or one person can have 2 or 3 of these risk components. But there's another group of people that are at risk, and those are smokers. Smoking is just bad for you. And I know that a lot of people don't want to hear that, because if you like to smoke, that's something that that you yourself are choosing for your lifestyle. But I'll tell you, from being an ex-smoker, and I quit smoking quite a bit ago, maybe about 8 years ago, and I am happy that I did. It's probably one of the best things that I've ever done, and it just really does a number to your body in different ways. And so smokers tend to have more issues with cardiovascular activity. It also impacts your blood vessels, your lungs. Smoking is just bad. I'm sorry, and I'm sorry. It's just, that's what it is. And so the last group of people that I think that have the highest risk of getting heart disease are the people that are obese. And that is because, obviously, having too much mass in your body actually makes your heart work harder than it has to. And so that is why it's so important that we try and keep our weight in check. And so I know that when I started gaining weight, I started feeling just very different. And so I'm not sure if it was affecting my cardiovascular activity, but I'm sure it was. But anyway, so people that are in the obese category are also people that are at higher risk of having heart disease. And so why I bring why I wanted to summarize the at-risk groups is because I think that, like I said, I think we can fall into one or several of those categories. And with heart disease, what I've learned is that it's actually fairly simple to try and prevent, the onset of heart disease. Now, obviously, everybody's different, but I do believe that with lifestyle changes, you can make an impact and actually improve the longevity and the quality of your life. So I'm now going to talk to you about those preventative measures that you can take to control or delay any onset of heart disease. And the first way that, and really a lot has to do with just, again, taking care of yourself. And so the first thing is making sure that you have a quote unquote healthy diet, meaning that you have a diet that is good in micronutrients, that you're getting your vitamins, that you're getting the right amount of food, vegetables, and just feeding yourself adequately. Now, I will recommend, a lot of people like to get their micronutrients from foods, and I do too. I sometimes struggle taking vitamins, but vitamins are a good way to supplement with supplement to get your micronutrients in the event that for some reason you're not hitting every micronutrient that's kind of essential to your body with the foods that you're consuming. So, eating the right nutrition, potentially taking a multivitamin, I think that would be great for you. Now, that leads on to keeping yourself physically active. Okay, so we're talking about heart disease and cardiovascular health. And so it is so important to keep your blood flowing and your heart pumping, and giving yourself that cardiovascular activity on a daily basis. I kid you not, I feel that going out there and walking 15, 30 minutes a day could do wonders to your health in the long run. I'm going to share with you some information. I mentioned to you that that my family, I come from a family that has high blood pressure, and I've been to the doctor, and I've repeatedly been told that I need to watch my blood pressure, just because I think I have that tendency to be going in the direction of higher blood pressure. When I was heavier, when I was 30 pounds heavier, I started getting my high blood pressure readings, and I started eating better, working out, doing cardiovascular activity, and I noticed that my numbers started to come down. And so I realized that making just general lifestyle changes definitely does help you in that regard. And so I do urge you that if you can naturally try and control your blood pressure with cardiovascular activity such as walking or running, it's going to help you in the long run. So going out there again, so preventative measure number 2 is get active, and just incorporating 10, 15 minutes a day, right after dinner, whatever. Put it in there, and to make sure that you're making that effort to keep yourself moving. I think that's really what I'm trying to get at. So just food for thought. So then now the third thing that I'm going to suggest is that you keep a healthy weight. And really, going back to my previous tip, it's that when your weight is in check, then you're in a better position to have everything kind of work in order. And so just making sure that you're not reaching obesity levels, that you're not putting too much force and too much excess that you're not pushing your heart to work harder than it needs to, is definitely something that is going to help you be healthier in the future. And so that in itself, again, it all has to do with eating healthier, keeping your weight in check, and moving more. So those are the top 3 preventative easy lifestyle changes that you could do to help prevent heart disease. Now, the last prevention tip that I have for you really is for those people that smoke, which I mentioned a little earlier. Smoking is just really, really bad for you. And so if you're someone that cares about your health or is thinking about changing your life and really getting healthier, and if you're a smoker, then my recommendation to you is try to kick the habit. It was certainly something that it was hard for me. I will share that story with you because I was a smoker at some point. And I just, one day decided that my health was much more important, and I was able to quit cold turkey. And one day I just basically said, I've had enough, and I've changed my life. And I can tell you with all honesty that it's been one of the best things that I've ever done in my life. And so hopefully, if you're a smoker and you're really looking to change your life, that you take on that challenge. So that narrows all of my prevention tips, which are really fairly simple, but it's something that once you incorporate it, you need to kind of live it through. And so by making decisions to eat better, to keep your weight in check, to be more active, to stop the smoking or the poor habits, once you do all that, then you're setting yourself up for a healthier life and to prevent heart disease. Now, let's move on to how to manage how to manage the most important parts of your body that you may not be able to fully control. So what do I mean by that? And this goes back to what I was saying about blood pressure, and going back to my example of when I started to gain weight, and I started going to the doctors, and they were telling me that my blood pressure was going up. And then I changed my lifestyle, and I started working out, and I lost 30 pounds, and so on and so forth. Again, I brought down my markers, and I was at normal levels. And typically you want to have your blood pressure at 120 and 80. And so when I started seeing those numbers, I was very, very happy. Now, with time, I have seen my numbers creep back up, and I'm still doing the same things, trying to eat healthy, work out, and taking care of myself. And so I actually went to see a cardiologist because I started getting somewhat concerned that my family history of high blood pressure was something that I was going to have to deal with. And I'm actually so scared of strokes, and I know that that's part of something that that my family has had to deal with, and I'm terrified of having a stroke. And so I ended up making an appointment to go see a cardiologist and to visit with him about my blood pressure readings. And so what I ended up doing is buying a little blood pressure meter that I use now to kind of track my blood pressure. And so when I went to visit with him, I had 2 weeks worth of readings. And so what I basically did is I took my blood pressure in the morning and at night, and I did that for 2 weeks, and then I presented to him with the information. And so, he took a look at it, and he decided that, I don't need to be taking a blood pressure controlling pill or whatever. So I don't need to be taking blood pressure medication just yet. However, I am going to go back and visit with him here in the next couple of months. So it'll be about 6 months since we last saw each other. And, just continue to have that discussion, continue to monitor my blood pressure, because prevention and knowledge is power. And so prevention of strokes and having information to present to your doctor that you can talk about gives you the power to take some form of control with your life. And so I bring that up because in terms of management, if you have a family history, and if you take anything away from this video, is if you have knowledge that either your parents or your grandparents, someone had stroke, my recommendation is to go out there and purchase a blood pressure meter, because they're like $35, $40, and I'll link one in the description below. But something like this could literally save your life, save the quality of your life. And it's really all about prevention, because again, strokes just come and really, they don't really tell you. It just kind of, they pop up. And so if we understand where we stand, we might have a better shot at preventing an issue with a stroke. I'm telling you, because from someone having family members that have had strokes, it's no fun. It's no fun for them, and it's no fun for you, the family member. So if anything, again, with this video, I'm trying to help and share the knowledge so you can, again, buy yourself a blood pressure meter and take your blood pressure once in a while and figure out where you stand. And when you start seeing some numbers that just don't look good, then you need to make an informed decision and go visit with a doctor and see if there's a need for you to, to get on some sort of blood pressure medication. But anyway, so I just really wanted you to know about that. And then the other thing in terms of prevention, and it has to do with diabetes and the amount of glucose in your blood. Now, there are blood sugar meters that you can purchase online or Walgreens, whatever. I don't use them, so I'm not going to sit here and kind of give you as much information as I did with the blood pressure meter. But what I would recommend is, if you are being proactive and visiting with your doctor and having lab work done on a yearly basis, make sure that you look at how your glucose levels are coming. Typically, they kind of tell you whether you are, your blood levels are, your sugar levels are high, if you're pre-diabetic or something. They kind of flag those numbers, but make sure you have that information with you. Let them, you'll get that report, and so just make sure you understand where you stand on that. Now, I don't think you need to be using that glucose meter, because you do have to poke and get some blood out, and so I don't do that. And the only reason that I think that I would start doing and taking measurements would be if for some reason I'm pre-diabetic, or if I'm already in the diabetic stage. And so again, that's something for you to think about. Personally, my only data point, and the one that I look for every year, is where am I when I do my yearly checkup, to make sure that everything's still in line. If anything ever changes, then I'll come back to you and just give you and share with you any of that information. But at this point, again, in terms of just keeping yourself managed, I really highly recommend that you get a blood pressure meter so you can be tracking how your blood pressure is doing. I can't really stress that enough, just how important I think that is. So that's it, guys. It really does boil down to taking care of yourself. Again, it's American Heart Month, and I am really passionate about making sure that I pass this information on, just because of how important it is for me and my family. And so I urge you to take care of yourselves. If you think that there's somebody out there that needs to hear this, please share my video. And if you like this content and you found any use out of it, please consider giving me a like and subscribing to my channel. I do talk about different topics, health, wellness, fashion, whatever, and I hope that you enjoy it. So again, if you did, consider signing up and giving me a like. And with that, guys, until next time, I'm wishing you have a stronger and healthier life.